Good afternoon and welcome to the Emergency Response Committee. Notice of the meeting was properly posted on April 27, 2020, and I will do roll call. Mr. Matthews?
Present.
Mr. Blau?
Here.
Mr. Taylor?
Here.
Mr. Davidson?
Here.
And Barnes is here. We have all members present. Thank you. Item number 1, discussion of possible action to set date, time, and place. Meeting will reconvene and then technical difficulties arise that cannot be corrected in a maximum of 30 minutes.
Make a motion for Wednesday at noon, which would be May 6th, in this room.
A motion in the second for Wednesday, May 6th, BOCC room at 12 noon. Roll call. Mr. Matthews.
Aye.
Mr. Blau.
Yes.
Mr. Taylor.
Aye.
Mr. Davidson.
Yes.
And Barnes is an aye. Motion passed. Item number 2, approval of minutes from April 20th, 2020. Do I hear a motion?
Move to approve. Second.
Got a motion in a second. Roll call. Mr. Matthews.
Aye.
Mr. Blau. Mr. Taylor.
Aye.
Mr. Davidson.
Aye.
And Barnes is an aye. Thank you. Motion passed. I'd like to, if it's okay with the committee, move to agenda item number 6, as we have several guests with us today in the interest of protecting their time. Discussion, review, possible action regarding presentations from Oklahoma County Clerk, Oklahoma County Court Clerk, Oklahoma County Treasurer, Oklahoma County Sheriff, Oklahoma County Assessor. Anyone from any of those offices care to give updates or share information in regard to COVID-19 situation? I would invite Mr. Prater also, sir, if you would care to address the group. Thank you for being here.
Sure. Thank you, Mr. Chair. Just briefly, I had a conversation with Presiding Judge Ray Elliott just moments ago to get an update on where we were with the May 18th, Monday, May 18th, and opening of the courts. He authorized me to advise this body that he's working on an administrative order that he felt like would be entered on Wednesday, this coming Wednesday the 6th, that would clarify what he classified as a soft opening and how to move things forward to that point, but allowing lawyers an ability to file lawsuits and providing for certain types of hearings to occur at that time. But we are moving towards opening the courts on May the 18th, Monday, May the 18th, for other than emergency type hearings and matters. And Judge Elliott, I believe, I would like to commend him, frankly. Judge Elliott's shown a lot of leadership in moving the courthouse forward on the legal side and determining what we should be doing now, what we shouldn't be doing, and then how we're going to open. So he will be entering an administrative order probably on Wednesday to clarify what activity will be allowed on Monday, May the 18th, and then further expanded potentially on June 1st.
Very good. Appreciate that information. Any questions or discussion from Mr. Prater? Thank you. Bet. Thank you for coming again. Yes, sir. Mr. Hooten.
So our staff is about 80% working from home. We have a small scale down staff, which we're rotating out each week. All of our employees have been given masks. They are asked to use them when they interact with the public. We do have plexiglass in our office that's been installed for some time, and we're going to go ahead and finish that through the rest of the office. Starting this week, meaning today, we'll be opening at 9 o'clock and closing at 3 o'clock. The reason being is we're trying to stagger being in the building so that our staff has the least amount of contact with other people. Our business, we stayed open the entire time. Most of our stuff is being handled online. It's been very successful. We do meet people at the curb to allow them to give us paperwork, and then we're returning it by courier. So we're being careful on how we do things. But so far, our office has done a really wonderful job, and I'm very proud of them. And so, do you all have any questions for me?
Yes, sir. Mr. Hooten.
Thank you.
Thank you. Thank you for being here. I think that's a good encouragement. We continue to talk about and encourage people to record and make special note of the efficiencies that have been gained through the different processes and the adjustments we've made, and maintaining those things, particularly where we've gained efficiency as we move forward and go through reopening, I think is a very important point that we need to continue to emphasize. And appreciate all the elected officials and department heads and employees, rank and file, who have been participating in that. Exercise patience and made those improvements. Thank you all very much. Gentleman from Sheriff's Office, would you care? Captain Bradley. Will Blake, thank you all for being here today.
Afternoon.
Afternoon.
The Sheriff's Office, name of the Judicial Bureau, will evaluate how to re-engage our workforce based on the needs of the courts and the county officials. That's basically how we're going forward here as far as reopening on the 18th. Anticipated timelines to start back to full service. Traffic court will start on July 24th. There's supposed to be two, an AM and a PM court. We anticipate several hundred people showing up at each session, and that's going to be a challenge. We are providing more deputies to the courthouse and to the elected officials as needed, starting on the 18th. We're going to call in reserves as well to help out. BPO court, it's unknown at this time. Emergency hearings are still being held. We're providing security for those. Jury's trials restart, I believe, on August 17th. We'll have that covered, additional deputies as well. Civil process and evictions, normal processes will resume as the sheriff's hold is lifted. Evictions are still on hold. Foreclosure sales, we should restart those on the 20th of June. Juvenile Center, we have no jury trials at this time. Our main goal is, of course, the safety of our judges, the public, our elected officials, and we're going to maintain all the security or all the safety standards put out by the CDC and then some. But that's pretty much the long and the short of it. Again, we will be providing more deputies on the 18th, starting on the 18th. And with me is Captain Bradley. You have any questions for him regarding the jail operations?
Good afternoon. So with an update for detention, I think everybody's aware we gave copies of the initial response plan to emergency management and health and safety. Since then, we have met a couple of times in the last week, kind of developing a post-COVID-19 response plan. Of course, that's going to be phases. There's a lot of external factors that's going to play a role in that when the courts start opening, some of those kind of things. We'll move those in phases. Phase one right now is kind of status quo, where we're at right now, looking at recommendations from the City County Health Department, the CDC, see what's happening in the community, other sheriff's offices, DOC, if any cases begin to spike, and then we'll reevaluate things there. As the courts open, that'll probably move us into phase two, and so on and so forth. And we're gonna move relatively slow while we assess everything that's going on. Just an update for you guys. Up to this point, this pay period, we've had 0 positive cases in the jail. So knock on wood, a little bit of luck there. We have had 6 employees that we've allowed to work from home due to high risk pre-medical issues, and then we've had a total of 54 that have been placed on quarantine through Primus Health just due to fever. None of them have tested positive. One, we did have a positive, and that was a new cadet in the academy. And all of those individuals went on quarantine as well. So that's kind of our stats up to this pay period.
Very good. I personally don't believe in luck. I think it's diligence and hard work. We appreciate what you guys have done for that population. That's a significant issue that you guys have kept that at the level of 0. And certainly be commended for that.
Absolutely.
Thank you.
That's incredible.
Yeah,
Great job.
Thank you.
Question about the courthouse entry. What dates do we plan to open that?
It's the east entry is going to remain closed. We don't have an opening date for that yet. But everything else should open up as the course opens.
So May 18th, that door?
May 18th is what we have plans for.
Okay, thank you. Mr. Rabbit.
Yeah. We have Mr. Bob Ravitz joining us online. Can you hear us, sir?
Yeah, can you hear me?
Yes, sir. Have any information or updates you'd like to share with the group?
I have a couple questions. As far as the offices themselves, specifically my office, will there be more cleaning? We're going to start having people, when the courts open on the 18th, people that are out on bond or whatever, actually coming to my offices. And my understanding is currently we really have no custodial support whatsoever. In fact, my staff is taking trash out into the hallway to bring it in. And I would just want to make sure that there would be somebody on a daily basis, at least, cleaning in light of the fact we're going to have more than just my office in there. That's my first concern. Then, as I think I told you, David, my secretary has not been able to get any sufficient supplies, such as Lysol, such as gloves and or masks. And I was wondering if there's what mechanism my office can go to get them. Again, we've been dealing with individuals solely who have been in jail. So we know what a fantastic job the jail has done, specifically Captain Bradley and his people and the sheriff, in making sure that everyone is protected. But now we're soon, and by the 18th and for sure by June 1st, we're going to have hundreds of individuals who are going to be dealing with my staff on a daily basis who are on bond or have been out in the community. And I wonder, is there a mechanism to supply those people if they come in without masks, and what is going to be done with regards to that. As far as my staff is concerned, we've been very appreciative of what everybody's been doing, the great work of Judge Elliott and the DA's meeting with us. Additionally, I'm trying to come up with some type of numbers as far as individuals who were trying to figure out what days they're coming in to try to limit entry into the office, but it's going to be very difficult once the courts open up. So it's just, those are my specific questions as to what can be done with regards to those issues.
Very good, and I appreciate those questions. I'll address the PPE while Mr. Monroe comes up to talk about the other things in your building. We have multiple vendors on list for PPE. I am not absolutely 100% certain of the availability of PPE through these vendors. It's going to vary. The supply lines continue to be strengthened. We see many, many more quantities of materials being made available. We are also, through my office, anticipating a pretty substantial delivery, possibly even today, and we will be able to provide some masks on an abbreviated manner. This won't be 5 per person for every day of the week or anything like that, but I will be able to provide some supply, I believe, before we go into reopening mode. So if nothing else, we definitely can help with a stopgap until vendors can be spun up or identified.
Thanks, David.
Yeah. You're very welcome, Mr. Monroe.
To speak to your question regarding cleaning and housekeeping services, we've provided for an additional, or have asked for an additional 20 individuals to begin the second week in May hand wiping every surface. That would put 2 people on every floor for the duration of the workday to clean repeatedly surfaces that people come in contact with.
Will that include surfaces within my office?
Yes.
Okay. Great, thank you.
Any other questions or discussion from Mr. Robbins? And again, thank you for being with us today, and you're certainly welcome to continue through the duration of the meeting if you're so interested. Appreciate that. Any other elected officials or their offices that would care to share or provide information? Hearing none, I'll entertain a motion to accept reports under item number 6. So second. Got a motion and a second. Roll call, Mr. Matthews.
Aye.
Mr. Blount.
Yes.
Mr. Taylor.
Aye.
Mr. Davidson. Aye. And Barnes is an aye. Motion passed. Thank you. All right, we'll return back up to item number 3. Discussion, review, and possible action regarding presentation from emergency management, health, and/or safety professionals. So my report for the group today. As a beginning note, severe weather is anticipated for portions of the state this evening, likely east and northeast of us, however, as usual, right on the line. So we'll have to pay attention to that. And timing is looking, as usual, about drive time. So the usual negative factors come together there. Again, main threats are large hail and high winds. Tornado threat is considered low, but is certainly still present. And we encourage people to maintain awareness. On the COVID, persistence in our preventative measures, including limiting travel and staying home, is more important now than ever, particularly as we go into reopening or reentry. We're still under Presidential Major Disaster Declaration, DR 4530 for COVID-19, including all states, and the Public Assistance, or PA category for emergency protective measures has been included in that. Center for Disease Control specific guidance remains recommending wearing a cloth mask when around other people, and all organizations encouraged to continue use of their business continuity of operations plan. Oklahoma is still under a state of emergency declaration that was enacted March 5th, and a health emergency declaration from April 2nd. And Oklahoma County has received CARES Act stimulus funding, and a reminder that is not part of disaster declaration related funding. And Mayor Holt of Oklahoma City has provided reopening, which, as we know, began last Friday on May 1st. And his document and main excerpts from that are available. If anybody's interested, I'd be happy to send you that. In Oklahoma, we're looking now at 4,044 positive test results. That is 72 new positive results from Sunday. And we have had 238 virus-related deaths reported through Saturday, and no new fatalities since Saturday, which is a benchmark, I believe. Largest numbers continue in Oklahoma County with 33, Tulsa County with 34, Cleveland County with 29. And at least 67% of the fatalities have had at least one comorbidity situation. Since September 1st, we've had 85 seasonal flu deaths and 3,507 seasonal flu hospitalizations September 1st through April 18th. That's interesting that that's almost 5 times as many seasonal flu hospitalizations as COVID-19. There have been 47,984 tests in the state as of the 23rd, obviously many more since then. We're still looking at 70 Oklahoma counties with positive cases, and we know of 2,467 Oklahomans who have recovered from known COVID-19 as of Friday, May 1st. For the state health department, there were 255 people hospitalized under COVID on Friday. Still looking at least 93 health department related test sites around the state and many more private labs doing testing. If a person's interested in that, I recommend they go to the state health department website for information and prerequisites, as it does vary per site. State health department again continues their symptom tracker and data dashboard, which is available online. Oklahoma City and Tulsa initiated phased reopening on Friday, May 1st. Many of you probably experienced here. A lot of folks got out over the weekend. Additional caution certainly is warranted because of that situation. First responder protection continues. Jurisdictions receiving positive case addresses to share with first responders. The National Guard deployment, Oklahoma National Guard, continues with several medical-related missions, and they're assisting with the strategic national stockpile. State Health Department report on correctional facilities still indicates 19 staff members and 5 inmates have tested positive. And DPS reopened some of their locations May 1st, and appointment and mask is required for persons participating in activities there. Oklahoma Forestry Service continues supportive personal protective equipment distribution, and as Mr. Matthews has mentioned, fraudulent unemployment claims continue to rise. And I was reading an article where a press release where Attorney General Hunter is taking additional enforcement measures to hopefully slow that process or deal with that process. Oklahoma County in general, 841 positive cases, 33 fatalities, and known 567 recovered since May 4th. There are still reported 23 positive cases at Tinker Air Force Base with restricted visitor guidance and revisions in available gates in place. 3 test sites plus private labs available in Oklahoma County: Fairgrounds Bennett Center, Walmart at Southwest 104th, and the OU Physicians on Northeast 10th. Information hotlines remain in place. City County Health Department Nurse Hotline 425-4489. State Hotline 877-215-8336. Shelter operations continuing in several venues and locations. Christy Jernigan Marshall at Oklahoma County Social Services continues to be engaged with those processes. They are anticipating potential increases with the reopening activities and other factors, and they're exercising caution due to that uncertainty. There are concerns about possible increased homeless numbers due to possible evictions resulting from the challenging financial situation. And shelter staff and guest screening continues with continued assistance and oversight from the Helping Hands group under the Mary Mahoney Memorial Health Care Organization. And there are multiple telehealth providers, both physical and mental health, available. They are continuing their coordinated efforts. City Rescue Mission still has available designated space for symptomatic cases, and they are continuing outreach efforts to the homeless who are currently not in shelters. As I mentioned earlier with Mr. Ravitz, the PPE supplies are improving. Supply lines are filling some. Oklahoma City County Health Department is still requesting donations of some basic items if someone can assist them. Recommend going to the City County Health Department website for information. And with severe weather, we are again discussing the sheltering issues, maintain social distancing, and make your plan early. not waiting until impending severe weather conditions develop. Internal Oklahoma County government, we are still under an emergency declaration that was approved March 25th. We continue to emphasize registration with ReadyOp, Emergency Notification System. And as we heard reports from Mr. Prater and others, District Attorney's Office is returning to full staffing May 18th. The Oklahoma County Court Clerk Office marriage license still requiring paperwork to be brought and completed. An appointment is necessary. And they are continuing to work on reopening procedures and strategies. In fact, we heard the Sheriff's Office talking about additional deputies and some of the things that they're going to be implementing around in support of that. Oklahoma County Clerk's Office has shifted to a 9 to 3 schedule, which Mr. Hooten mentioned. County Treasurer is taking cash payments on the 3rd floor now, one person at a time, and a mask is required. On May 5th, last Friday, we had 202 persons through the door and 16 inmate shuttles. VPOs and marriage licenses still creating significant traffic. Emergency Management, working with the Office of Emergency Management at State, is continuing to support the Community Disaster Loan Program. Hopefully we'll hear something from FEMA soon about the application that has been submitted for the state of Oklahoma. The Oklahoma County Emergency Management First Responder Personal Protective Equipment point of distribution is still in place using our full staff and several of our volunteers. And we've accomplished distributions to approximately 70 jurisdictions and counties in the central area. That includes law enforcement, fire rescue, emergency medical, and other support entities and some universities. Expecting, as I mentioned to Mr. Ravitz, a potential bulk order, hopefully today. And we also took, over the weekend, I took delivery of hypochlorous acid, which is a oxidizing disinfectant that's widely used in the food industry. We're currently reviewing, and I had a discussion with Mr. Monroe earlier, and with Chris, we're going to be talking about getting some of that material to Oklahoma County to use. The advantage to that is it's 100% natural. It's all organic natural. It's 99% water, less than 1% salt, goes through a specific electronic process. So it is not hazardous, and because of the 99% water, you can spray it directly on things as long as you don't drown them. It's just going to evaporate. It will kill germs. There's a lengthy list of different bacteria and germs and things that it kills. So it looks like it may be a very effective alternative for us, again, without introducing additional toxicity into the area, which I think is a big deal. I know it is for me. We completed our 6th pod operation on Friday, again, as I mentioned. We already talked about the court and the courthouse activities. Notable, Oklahoma Medical Reserve Corps is still soliciting medical and non-medical volunteers, and the warning signs and symptoms for COVID-19 have not changed since the last CDC update. And personal protective measures remain consistent: frequent hand washing, covering the cough or sneeze, and wear a face mask when in public. Social distancing and avoiding groups. Stay home if at all possible. Opening packages outside of the home or work area. Received another notice today. Blood supplies are still at a critical level. American Red Cross and OBI is encouraging people to donate. And false information continues, as you've seen. Avoid media and social media reports and information unless known credible sources. And view statistics and projections realistically and not let the hype affect you. Overall encouragement is to take personal responsibility and practice prudent preventative measures. Unless there is discussion or questions, that concludes my report for today.
I'd like to just make a comment on the project on unemployment claims. We continue to get those. Most of those are going to Karen Kent within my office. She is working each one of them individually, contacting the person named. I think we've got 4 or 5 additional on Friday. But we're getting, thanks to the DA's office, we have an affidavit that they signed along with a letter that's sent to OESC. We're continuing to work those on a daily basis and getting some response back from OESC that they have stopped any additional activity on those particular claims. So it's a big issue. I think you said over 3,000 statewide, and we're going to continue to work those. If anyone's listening or watching this within the Oklahoma County family, if you get some of those and you want to send them to Karen Kent or to me directly, we'll be glad to handle those and take the the lead on getting those dealt with and processed.
Thank you.
You don't know how many we're up to now, do you?
I think it's somewhere in the neighborhood of around 30 that I'm aware of. As far as I know, we've only had one that has slipped through, and the fraud folks at OESC were able to pull the money back.
Okay.
And so I don't think as far as I know, we've not been out any actual money.
That's great.
You mentioned the uptick in homeless.
Yes.
With increased evictions. I thought there was an executive order to restrict evictions.
They currently are. They are not processing. I don't know if Oklahoma County evictions are currently not being processed either. That's anticipation of that occurring because of the financial situation.
So how is and to follow up that, how are they winding up homeless and being evicted? And are those individuals being turned in?
We don't know of any increased numbers as of yet. Again, that's a monitoring aspect. People that would show up at shelters or whatever, that combined with the reopening, anticipated potential surge in cases or symptomatic folks there is continuing to be monitored.
Yeah.
Any other questions or discussion?
Motion to receive report.
Second. Got a motion second to receive report. Roll call. Mr. Matthews?
Aye.
Mr. Blau?
Aye.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
Barnes is an aye. Thank you. Item passed. Number 3. Item number 4, discussion, review, and possible action regarding presentation from BOCC departments. Anyone care to provide information? Right. No action on item number 4. Item number 5, discussion, review, possible action regarding presentation from facilities management. No action on number 5. We've already taken.
Okay, go ahead. No, you're all right.
We've already taken action on number 6. Item number 7, discussion, review, possible action regarding reentry provisions of plans for Oklahoma County offices and facilities in regard to COVID-19 situation. I do have a checklist that I provided to the group the other day. I've added an item to that based on our meeting of Friday because of a 1 o'clock Criminal Justice Authority meeting to take place in this room. I don't know that we can jump into this.
We got a while.
In
We got
depth.
3 minutes so far.
Okay.
We can start knocking some of them out. Keith, were you consulted on the 4th floor, the way that they've directed traffic and hazard separations and then?
No, there was a brief conversation once those dividers were put in place, but that was not my design of doing it.
Yeah, I'm just curious if it was going to work or, I mean, if that's following some sort of guidelines or where that came from, so.
I think the court clerk is one to ask.
Okay.
I believe my biggest question that we're going to have to reach some clarity on, and Mr. Ravitz alluded to it, and I've had discussions with other people. Mr. Billingsley asked about it earlier today, and we've discussed in these meetings is the provision of personal protective equipment. My personal opinion and recommendation in regards to the public is, as we saw in a previous document, that we continue to promote signage and discussions among elected officials and other service providers of Oklahoma County that people coming to do business at Oklahoma County wear a mask. And we know that that certainly will not be 100% saturation, but those who show up and do not have a mask, providing that my bulk comes in this afternoon or prior to opening, we will provide some abbreviated masks to the people who do show up to do business who may not be wearing one. I have concerns about becoming known as Mask Central and start long lines of mask distribution. That's obviously something that we don't want to get engaged in. But for employees also, I'm certainly interested in providing for employees. The question remains how many. And we're looking at both the N95s or KN95s as well as surgical masks. So we need to make a determination of type. I don't necessarily mind leaving that up to an individual employee's discretion if they have a preference. The number to be issued is a question that we're going to have to answer. And I am getting bulk of gloves as well. And in some places, maybe where they're handling money or handling documents, some of those kinds of activities, gloves could certainly be warranted. In other areas, maybe not. We're going to obviously have to rely heavily on department heads and elected officials for some of those determinations and the actual number of employees, but we're still going to have to determine what depth we provide those materials.
So you mentioned DPS earlier. And a DPS is, let's just read it off here. Social distancing guidelines will be enforced and the number of customers in the building will be limited. The public will be required to wear a mask that covers their mouth and nose, answer health questions, and have temperature taken before being allowed access. Only the customer will be allowed in the building with some exceptions, i.e. parents of minors interpreters. So I think requiring the public to wear a mask to come into the building is probably a good start. The issue there that I can see is if they're required to be in court or at some sort of judicially told event, drug testing, etc., and they don't have a mask, are we going to provide that for them? I just don't know how we answer those questions, because my fear is that we start handing these things out and then everybody comes in, walks in, grabs a mask, turns around and walks out. And I do believe that's what will happen, because I'm not entirely sure that the general public has been able to get their hands on the types of masks that you're talking about handing out, the N95s and the taking of the temperature. That seems to be one of the big things across country. Cleveland County is now opened back up and are requiring temperature checks of each individual that comes in. Today's their first day of that. I'd be interested to know how well that's going. Of course, we're not going to have the foot traffic that we are, but I think following the lead of the state agencies is probably a good start for us to do.
So, Miles,
Yeah.
with regard to temperatures, are you aware how Cleveland County or even DPS is conducting those? Is it medical personnel? Is it non-medical personnel? People that are in a position to make some kind of determination what they're using, etc.
No.
Do you know how Cleveland County is working with the judiciary in the event that someone that comes for court is turned away because of running a temperature? Are they providing a note?
Yep, don't know any of that. Just what I've read. That's why I'm wondering how well it's working out for them. And those questions may or may not have been brought forth by them as well. So
Additionally, I think it's problematic in that running a temperature is a sign of something else beyond potentially COVID-19. And the fact of the matter is, mask, temperature taking, etc. People can be a carrier of COVID-19 without being symptomatic, which is in and of itself probably a greater issue than turning someone away that has a temperature. And my concern is that when people show up at the courthouse, if we're taking their temperatures and they're turned around and they miss a court date, what ramification does that have? We turn someone away because they have a temperature and then they self-identify as having some other type of medical condition. Are we violating any type of HIPAA? Now, I know the governor's order has done some things with HIPAA, but that's as it relates to being able to provide first responders with information when they're going to the home. I'm greatly concerned with the temperature taking. The mask, not so much. If we take a concerted effort to make sure that through our platforms, we're getting it out there that people need to wear a mask when they come down here. I think it's completely reasonable to provide masks to the public as long as supplies allow. Again, you go back to what I said about the temperature, and you mentioned the court proceedings and not having a mask, etc. I think there's a way to to educate people to wear a mask. But in the event someone is here for court or some other purpose that they just have to be in the building, perhaps we can help. I don't want to be mask central either. I understand that concern. But
Yeah, I'm not sure.
the temperature aspect of this whole discussion is one that I and my boss at Last Check, we're not greatly interested in, especially if it's just, you're going to put me down there. And plus the accuracy of the devices. There are a number of problems.
There are, but you're seeing this as a normal across the country. I know that there's a court case in Texas, that they're hearing this exact issue. I don't know what will come of that, but you're seeing Harris County, Dallas County, you're seeing LA County, you're seeing these large counties across the country that are moving forward with this. You have to not only be temperature checked, but you also have to be COVID-19 checked before you even step foot into the White House. Now, are they breaking civil liberties there? If you want to come into a public building, I get it. It's a great discussion, but no shoe, no shirt, no shoes, no service is a health concern. That's why we do that. This is a health concern. We owe it to the general public, we owe it to our employees, that we should do our due diligence and check each individual that comes into this building. And I understand you're concerned about HIPAA, but they have the option to leave or they have the option themselves. We're not asking them to identify what it is. But if they would like to identify, I don't know how that's a violation. We're not forcing them to identify. Well, now if they got a court case or something, I think we should confer with Judge Elliott. And I'm supposed to be talking to him this afternoon and going over probably a lot of what Mr. Prater went over.
Well, and it's not you that has said this in regard to temperature taking, but there's been some discussion, and it's at least been mentioned, that we would take these people's names and contact information. And so...
Yeah, now I fully understand that. I think that's probably the line and that's going over. But saying that we're following CDC guidelines, you're over 100.4. I don't want that, it's not that I don't want you, I don't want you to vote. I mean, I will say that. I mean, it's kind of unnerving. But, I mean, if they want to self-identify as saying, I've got X, Y, Z, but if they're here for court, I think we at least go to the judge for them to say whether or not they want them in their court.
I think, well,
But I'll have that discussion and tell you guys what that is later. And I understand. It's one of those things that the bridge too far is taking their names and such and turning those over. And I know that that's been mentioned in a question of whether or not we should be doing that if we're going to take somebody's temperature. So
those are some concerns that I have. And
I would share that one with you. I certainly don't want to be taking people's names and turning them over.
Mr. Prater?
Mr. Chairman, if I may.
Yes, sir.
Yeah, 3 representatives of county commissioners sit on this board. And it's very easy. The things that I've heard discussed, it's very easy to put down your written request for a legal opinion to our civil division. I'm not trying to generate more work for these people because they work a lot, as you guys know. But this is exactly why we're here, to prevent issues, to prevent civil liberty violations, to prevent constitutional violations. What are the parameters? What is reasonable? What is not reasonable, even in the times of emergency? Americans with Disabilities Act, as Carrie just raised, as she whispered over to me, she said there may be ADA compliance issues as well. So what I might suggest to this board, Mr. Chairman, is that those who work for the county commissioners on this board could be a conduit of this body to ask for a legal opinion as to what the parameters might be, what would be legal, what would not be legal, what would seem to be a violation of civil liberties, what would not, what might be a violation of constitutional provisions, what might not be, what might be violative of the Americans with Disabilities Act, and what might not be. I believe since we've got 2 weeks that we could attempt to expedite that information for this body if the request is made, but that request has to be made in writing. Unfortunately, many times when we're asked for a legal opinion, it's on the sidewalk as we're walking into the building, or when someone catches me on the fifth floor going into a courtroom. We can't operate that way. But we are more than happy to assist this body and the county electeds and any others, the citizens who we serve, by offering that legal advice to you if the written request will just be made to us.
Sure. I appreciate that.
Sure.
That's a great offer. And that'd be my recommendation. If nothing else, it will serve to clear the air and set a baseline on these discussions as to what we can and cannot do, and then we make a determination from there.
Can I ask you a quick question? Can Mr. Barnes just submit it? If we ask him to submit that,
Well,
essentially what you just said, just submit it. Is that?
yeah, but what, I mean, I don't even know why you need to go through that hoop and determine if Mr. Barnes is the appropriate person to make that request when I know for sure that your bosses can, Commissioner Mont, Commissioner.
I was just trying to say more three separate deals being entered. I mean, if we can agree that three separate opinions won't be asked for, great, but I just see.
Well, certainly the three of you can get together and formulate a question and one submit it. I mean, it can't be that difficult. Shouldn't be that difficult.
I don't know, I think three of us getting together would be kind of interesting. That might be an open meetings violation.
I think perhaps we could do it here, though.
Yeah.
We could draft the question here.
I mean,
I could bring mine to the table, Miles, you can bring yours, and we could hash it out here.
I think he basically just said what we need to know. And I would, we could go back and rewind and take it verbatim and run with it. That's my opinion. I mean, if there's other stuff, Joe, that you'd like to know, or Taylor, that you'd like to know, now's the time.
Good, I think that's it. The ADA and the civil liberties are the key issues with HIPAA.
Thank you.
And there might be, I would assume that state agencies have asked these same questions and have asked the AT. I know it happens with this. I don't even need that math to
I
come
wouldn't
off.
depend on anyone else that's been doing a lawsuit if the
Right.
county gets
Yep.
sued. So, this is not that difficult, Miles.
Oh, I agree, it's not.
I mean, so
Absolutely.
this body has a responsibility to move forward in a safe manner. You've done very well in doing that. So certainly, you can come up with the questions you need to ask about how you move forward, and we'll do that for you. I mean, you're going to want us to answer those questions because it's not some other group or some other body or someone else that's going to be defending you in a lawsuit, if in fact that's what you're concerned about. Frankly, you're concerned about obviously the health, safety, and welfare of our citizens and our employees, which I'm sure you are, but also any litigation that may come. And in light of the questions that are being asked and bannered about, you're concerned about that as well, I'm sure.
Well, I'm least concerned about the litigation.
Yeah, sure.
I mean, I just really am.
Okay, I was trying to provide an opportunity for you to get the answers to the questions you were asking each
I'll
other.
submit the question.
So
Yeah, I
if
mean,
one of you
we
guys
can
want to
get
sit down and actually put pen to paper and get that question to us, we'll answer it. You want to continue to just talk about it and argue, go ahead and do that too. You're not going to get answers.
I'll get something submitted if this group does do it. Yes, sir. Thank you.
Should someone submit a lawsuit because of an action we take, the first question they're going to ask is if we seek guidance from the district attorney's office. Thank you. Further discussion? I was also wondering about PPE for highway district employees who are not in the facilities. Some I'm sure have contact, particularly the office folks. There's a certain amount of traffic at the offices with the highway district.
Well, at the start of this, we went out and secured PPE for our folks. We were slightly delayed in getting that delivered. It's just been within last week, but we're now have a supply on hand to get a couple months, 3 down the road for our folks.
Other discussion, anyone?
Say that we're at 12:50, so we're getting pretty close to the jail trust meeting, so.
Unless someone has a motion in regard to the request of District Attorney's Office, I believe there's no action necessary on item number 7 from this group. Item number 8, discussion possible action, determine next meeting date and time.
Mr. Chairman, I'd move we set our next meeting for next Monday, the 11th, at noon in this room.
Second.
Got a motion and a second. Roll call. Mr. Matthews?
Aye.
Mr. Blau?
Aye.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
Barnes is an aye. Monday, May 11th, BOCC room at 12 noon for our next meeting. Board comments. Mr. Matthews?
No, thank you.
Mr. Blau?
No, thank you.
Mr. Taylor? Mr. Davidson?
No, thank you.
And none from me.
Motion to recess till Wednesday, May 6th at noon in this room.
Second.
Motion second. Roll call. Mr. Matthews?
Aye.
Mr. Blau?
Aye.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
Barnes and I. We stand in recess till Wednesday, May 6th, 12 o'clock noon in BOCC room. Thank you all for being here.